Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President, CEO here at the Dallas-Fort Worth Hospital Council. We want to thank you so much for being with us today. This is an educational webinar. We're hosting it in coordination with the Ambassadors for Aging Well, a associate member here at the Hospital Council, and with them also Healthy Democracy, Healthy People. You know, today's topic is health and voting, and this really should be a really good topic. As you know, and as I say frequently when I give speeches in the Metroplex, believe it or not, we treat Democrats and Republicans in our hospitals. So we try to be non-political in any way. And we're not here to promote any particular party. We're here to promote, please register, please vote. How you vote is your own conscience, but it's important that you exercise your right to vote and to get involved, especially when it comes to health, healthcare, things that you work and live every day. So as we look at this topic, we're going to talk about how is health related to voting? What role does the healthcare sector play? We're going to discuss some recent studies that revealed a connection between civic and voter participation and community health outcomes. So we want all of you to sit back and enjoy our speakers. Today, we're delighted that we've got Elva Roy, who's founder and lead ambassador for the Ambassadors for Aging Well. We've got Jeanne Ayers. Jeanne is a registered nurse and executive director and founder of Healthy Democracy, Healthy People. And also we've got Gnora Mahs, a doctor of public health and a partnerships director in Health Democracy, Healthy People. Before we begin, one administrative note: if you have any questions, feel free to type them in the question box or the chat box. We will answer them at the end of the presentations. So with that, it's my honor to introduce to you Elva Roy. Elva, take it away.
Thank you. And a big thank you to the DFW Hospital Council for scheduling this meeting. Thank you, Steve and Stephanie and Chris. And just a brief introduction of myself. 11 years ago, after I retired as Vice President of Strategic Procurement from Affiliated Computer Services in Dallas, I founded a community group in Arlington called Ambassadors for Aging Well. And after 11 years, the Ambassadors Group is still very active and we have 500 members. 2 years ago, Arlington's Mayor Jim Ross asked me to chair his advisory council for older adults, so I do that, as well as serve on various boards such as Tarrant County Adult Protective Services, and I'm the secretary there, and I serve on John Peter Smith Hospital's Joint Council, and more volunteer board activity. A couple of months ago, I learned about Healthy Democracy, Healthy People when they presented at a meeting of the National Academies of Sciences, Engineering, and Medicine. I left that meeting inspired by their effort to make community health better and decided to do what I could to support them. So I renewed my volunteer deputy voter registrar certification, and here we are today. After you hear what our Healthy Democracy, Healthy People presenters have to say, if you're moved, as I was, to support their effort, here are a few ways that you can do that. So number one, upon your request, volunteers from Ambassadors for Aging Well Group will deliver postage-paid voter registration applications to your facilities, and/or, upon your request, volunteer deputy voter registrars from the Ambassadors Group will staff a nonpartisan voter registration table on premises at your location, and/or you can host a nonpartisan event at your facility on September 17th which is National Voter Registration Day, and free resources are available at www.nationalvoterregistrationday.org. And lastly, you can attend a Zoom meeting hosted by me to learn about voting requirements and upcoming deadlines. And to request more information, please contact me and/or attend a Zoom meeting that I'm going to host. And that information is on the next slide. But my email address is easy to remember. It's just elvaroy@gmail.com. So feel free to reach out to me. And if you want more information, be sure to attend one of these two Zoom meetings hosted on a Thursday at 10:30 a.m. or a Friday at 3:00 p.m. at the information shown here. So now let me give you a very brief introduction to Jeanne Ayers and Gnora Mahs, today's presenters. And I said brief because I could spend the entire time we have today if I were to tell you everything that these two presenters have done and are doing to make community health better. So let's start with Jeanne. Jeanne is an RN and she has a master's degree in public health. She serves as the executive director of Healthy Democracy, Healthy People, a coalition of 10 national public health organizations focused on advancing health equity by assuring that participation in the electoral process is available to everyone. She served as the Wisconsin State Health Officer and Administrator of the Division of Public Health and as Assistant Commissioner and Chief Health Equity Strategist for the Minnesota Department of Health. Prior positions include Director of Nursing and Preventive Services and Occupational Health at the University of Minnesota, and she worked in professional continuing education for 15 years and founded and directed the Centers for Public Health Education and Outreach at the School of Public Health at the University of Minnesota. And her sidekick today is Gnora Mahs. Gnora holds a doctorate and a master's in public health and is the partnerships director of Healthy Democracy, Healthy People. Gnora grew up in a family filled with organizers and started her professional career as a community organizer after graduating from Ohio Wesleyan University. She strengthened grassroots movements before pursuing her graduate degree at the George Washington University's Milken Institute School of Public Health. Previously, Gnora worked at the Alliance for Youth Action, where she supported youth-centered organizing on democracy reform and economic justice across the country. Gnora received a doctorate of public health at George Washington University, and her dissertation research focused on the relationship between voter participation and community health. So without further ado, let me introduce our key presenters, Jeanne Ayers and Gnora Mahs.
Thank you so much, Elva, first of all, for your leadership, for helping us make these connections, and for that very generous introduction and encouragement. We're so pleased to be here today. For myself, and Elva shared, I have been working in the field of public health and/or worker health and safety for my entire career, and it has become more and more apparent that there is a very close connection between our health and our democracy. And so that's a very short way of describing why I'm doing the work that I'm doing right now. Slide. So the definition of public health, and I consider all of us in the health sector to be actually contributing to public health, but public health is what we do collectively to assure the conditions for all people to be healthy. So we have to look at what creates health and then think, how do we work together to assure those conditions? And the Healthy Democracy, Healthy People coalition is dedicated to building our collective influence and power to realize health and racial equity by strengthening democracy through inclusive civic and voter participation. In a very short slide, very short description of why and how this works is that we see higher civic and voter participation leads to more influence, more power to influence the environment, the policies that influence our health, and therefore leads to better health outcomes. But in fact, also, the reverse is also true. So when we have low civic participation and low voter participation, we have less influence over the conditions that are important for our health, and we have worse health outcomes. And we can often see this when we look at data across countries, when we look at data across different populations, or when we look at the data, as we will a little bit later, across the nation. Our organization really thinks about creating, so we actually have 11 national public health organizations in the coalition, and they represent about 1,700 to 1,800 institutional members, so academic schools of public health, state and city and county health departments, and professional organizations like the American Public Health Association with individual members. And there's about 50,000 some individual members along with those institutional members. Next. So we have an approach that we think is important if we're going to build our collective influence. And the way that we do that is we organize ourselves in our organizations, and as I just described, our coalition, that was one of our first steps. And we organize the policies and the resources and the way stuff happens, the support, the position statements. We help adopt those kinds of things to facilitate the action of a healthy democracy. And we organize the narrative and the research, the data. We do the analysis, and then we lift that up and we disseminate it. And those three practices work together. And when we describe our work, you'll see these interconnected. And the reason, next slide, the reason when we think about, when we look at, well, maybe I should just step back. This coalition, we came together in 2020. And we came together because we felt it was really important. We probably should have always been promoting inclusive voter participation, but we felt like in the middle of the COVID pandemic, it was really important for public health people in particular to be saying with one voice that voting was important. And if you had a risk factor, there were ways to vote safely, rather than we could have had been in disarray and said, don't go if you have a risk factor. But we started in 2020 together to begin to tell that story. And when we were first looking at the data, the data that we were relying on was really somewhat historical and then international. And we see that whenever we've expanded electoral power, it has improved health. So for example, when women's suffrage came to fruition in the 19th century, maternal child health mortality rates declined by 8 to 15%. And the voices of a broader set of people were helping prioritize MCH types of investments, which helped contribute to that. So there's a enfranchisement, but then also the policies that flow as a democracy is more responsive. In the 20th century, with the civil rights movement, that ushered in more inclusive policies in education and housing, economic opportunity, and healthcare, including Medicare and Medicaid. And what we saw was that with the Voting Rights Act, we saw reductions in Black infant deaths in southern counties that were specifically subject to pre-clearance. So there was a direct link between the Voting Rights Act and decreases in health disparities. And then in 2010, following the passage of the ACA, advocates organized to assure Medicaid expansion and more people were covered. Those are examples of when we've expanded electoral power and how it can improve health. But every single time that we've done anything, that we've expanded the franchise, there's also been a struggle for influence and power, and there's a pushback. So it's not like you can just rest after something happens. We have to continually stay engaged. So the next slide. So one of the things that happened was at the end of 2020, by the way, in 2020, we had the highest voter turnout that we have seen historically across every single demographic group. You know, every population actually turned out at a higher level. And just think back, we did not have vaccines yet. We had all been isolated. Many of us had been isolated. People, we were really in the throes of still the beginning of our pandemic. And yet we had this high voter turnout. Some things happened that helped that, and that was that there was a concerted effort to let everybody know the different ways that you can vote. Many people had never realized they could vote absentee, or they could vote, you know, what the deadlines were and all of that. So there was conversation about that. But I think that there was just a concerted effort on the part of the country to pull together and do something together. So there was that. But and being public health people, we were tracking COVID outbreaks. And when we should have been celebrating that turnout and the fact that there was no COVID outbreak related to the election in 2020. There was no COVID outbreak related to the election in 2020. I just think that's spectacular. And when we could have been celebrating that, there was this very large push or strong pushback. And I mentioned this already. Whenever we've had an expansion of the electorate, whenever we've moved forward in terms of inclusion, there's often a pushback. And there was a narrative pushback that there was election fraud or this or that. And anyway, the dialogue became quite divisive. And we felt that as public health and health people, we could tell a bigger, more aspirational story about the value of inclusive inclusive democracy. And so we began the process of looking at the US data, and we created this Health and Democracy Index, which came out in 2021. And in that, we look at what we call the cost of voting. The cost of voting index, we use that tool, which is a political science tool that looks at the laws and the policies that make it easier or harder to vote. And then we took 12 public health indicators that we often use to say, how is our community doing? Infant mortality, premature mortality, self-reported mental health or well-being, 12 different indicators around that. And we looked across all the states, all 50 states, and we analyzed that data in relationship to the public health data in relationship to the cost of voting and restrictiveness or ease or difficulty of voting. And what we discovered was that states with more voting access and greater civic participation have better health outcomes. And we'd kind of known this intuitively. We'd seen it internationally. We'd seen it historically, but this was evidence that it actually was true here, state by state in the US. And when communities vote, they influence those policy decisions that have an effect on their health. And you can find the Health and Democracy Index online, and you can use it and download it or do whatever you need with it. But next slide, I'll just go into it a little bit. It's set up to really help us see the pattern in the story. So what we see here is a pattern where we're seeing better and worse health on the vertical axis and less and more voting access on the horizontal axis. And you can see that there's this pattern. Each of those boxes is a state, and we starred Texas. So you can see that Texas has the least voting access or ease of voting, the highest cost of voting. And then that then flows with also, being in that lower left quadrant for worse health. But we see the states where we have more inclusive voting have better health. And then this is just a summary slide, but you can look at this data by by, you can look at the data by state, and you can, and this is focusing in on Texas, and these are the different kinds of health indicators that we have included. This is just a sample of them, but overall health, infant mortality, premature mortality, community safety, and wherever, when you look at that, there's an explanation, you know, and you can dig into all of this on the index. There's an explanation, but when that little slider is headed toward the red side, which flips back and forth a little bit, that's the least healthy side, and the green is the better health side. So anyway, you can dig into that. So we created that in a way that people who are shepherding some particular health condition like infant mortality or community and family safety, or can find the data that relates more specifically to them. And this brings us to the kind of the why. How did it get this way in Texas? Well, here are the policies that ended up getting Texas into the box of highest cost of voting. When we ask about inclusive voter registration, no, you don't have inclusive voter registration. And there is restrictive voter ID, and it's not easy to vote at home. And there is not the policies that allow people who have completed their incarceration to be able to vote. Those are packages of policies that are being analyzed through that cost of voting index and compare all 50 states. And civic participation, civic participation numbers where voter registration is 72%, or 76% of eligible, what's this, Gnora, what's this? 76% of eligible people are registered to vote, it says, but 72% is listed there, so I'm a little confused.
Yeah, sorry everyone, it's a little bit confusing. I think the smaller text is the national trend, so you can see that in Texas, 72% of eligible voters are registered, which is below the national average, and 60% in 2020 of eligible voters in Texas cast a ballot, which is again lower than the 66% of eligible voters nationwide that participated.
Thanks for that clarification. So anyway, what we this is just a quick summary. Like, you could go onto that website and dig into Texas in more depth. Next slide. What we generally have discovered then is that there is a consistent association between civic and voter participation and health. So states where it's easier to vote are more likely to have better rates of state level self-reported health. And this is just a summary of some of the research if you wanted to dig in further. That particular study looks over from 1996 to 2020 and was published in 2023. And then where states have shown where it's easier to vote, we have lower uninsured rates. And that study came out in 2021. Counties in states where it's easier to vote had lower pre-vaccine COVID case and mortality rates. And state institutions that promote political accountability are associated with lower infant mortality across states that promote checks and balances. They're associated with longer life expectancy. And again, these are some of the more recent research that came out even after we began to do this index. Next. So what can we do? When I talked about those three practices, we talked about organizing ourselves so that we can all participate and be champions, and then about the data so that we can help tell the story. And now I'm talking about how do we align and take action at every level. So we can take actions within our very own organizations or even in our community groups and families. We can take actions within our professional associations, and we can take actions at the national and state level. So these are some of the things that we have done in the last few years. First, we worked together to get Healthy People 2030, or Healthy People, the framework for the nation. That's the health framework that sets the national health goals and helps us then align our actions at the state and local level. And we were able to provide enough data and support to have Healthy People 2030 name that increasing voter participation is and should be a core health objective. So that's important, because then it means we're tracking that data and we can set the stage for, I was the state health officer in Wisconsin and led the state health planning process in Minnesota. At that level, we can say, oh, the Healthy People 2030 named this. Now our agency is going to be able to do this as well. Then when you're a hospital, and a nonprofit hospital or a nonprofit insurance company, you can then also have this align with your responsibilities to improve community health. So taking action to promote civic and voter participation becomes a legitimate thing to be doing, and it's aligned. County health rankings and roadmaps is a national initiative that's been going on from the University of Wisconsin Pop Health Institute for, I think it's probably almost 20 years now, tracking the county level health data. And in 2023, they focused on and added civic health and civic infrastructure. And part of that includes voter participation as well as census participation. And it goes beyond that as well into other civic health or civic infrastructure components that can be tracked and supported. And then these professional organizations, the AMA, APHA, the Society of Public Health Educators, the American College of Physicians, have all passed policy resolutions that are position statements recognizing voting as a vital condition for community health. So it's become, we've talked a lot over the last 20 years about the social determinants of health, but what we're seeing is that one of the determinants of the determinants is civic and voter participation, or it's a political determinant of health. And that's how that comes together. Next. I think I get to turn it over to Gnora, who's going to talk about what we can do together and what we are doing as a national coalition.
Yeah. Hi, everyone. My name is Gnora Mahs. I'm the Partnerships Director at Healthy Democracy, Healthy People. Thank you, Jeanne, for sharing all of that data and research. But you may be asking yourself, okay, so we understand that health and democracy are interconnected, that voter participation is key to the health of our communities, but what can we do in a health system or as health professionals or health organizations to, work on promoting inclusive civic and voter participation? Well, I'm really happy to share that Healthy Democracy, Healthy People is in partnership with Vote ER and Civic Health Alliance. And earlier this year, Elva actually mentioned this in her remarks, we launched an initiative with hosting a national launch in February with the National Academies of Science, Engineering, and Medicine. And the initiative is called Thrive Through Civic Health, We Will Vote. And it's a concerted effort to organize across the health sector, including healthcare, public health, and folks working in the social determinants of health, to come together and promote inclusive civic and voter participation this year. You might be asking yourselves, why do we need to organize the health sector? Well, we are actually the largest workforce in the country, accounting for at least 22 million workers, and that 22 million actually only accounts for licensed health professionals. So we know that there are many more in our sector that are undercounted. And that 22 million represents 14% of all workers in the United States. So we are a huge sector and pillar of society. In Texas alone, the health sector accounts for approximately 1.8 million workers. So huge part of the Texas workforce. And in 2020, specifically in Texas, 48% of eligible Texan voters did not vote. And similarly, in 2022, over 60% of eligible Texan voters did not vote. And what's more surprising and concerning is that healthcare workers, including physicians, nurses, physician's assistants, and dentists, are 12 to 23% less likely to vote than that general population statistic. So we have a real opportunity to organize across our sector and make a commitment that we will vote. So how can we take action through Thrive Through Civic Health? We will vote. This is a strategic call for the health and nonprofit workforce and members to promote voter participation with colleagues across organizations and the communities we serve. We can work together to build our power and collective influence and advance health equity by expanding the current public understanding of this critical relationship between voter participation and health, which then builds support for policies that assure an inclusive representative democracy as we as individuals begin to understand and unpack this critical relationship. We have been hitting the ground running. We currently have about 63 organizational champions that have committed to promoting civic and voter participation across their workforce and members. And these organizations represent over 99,000 health professionals nationwide. All of our partners are listed here, and there are a ton, and you can see that they range from, large national public health and health organizations to state and local health organizations, and even some local clinical practices. So we're really excited to be engaging this wide berth of the health sector in this strategic call to action. And so this is an open invitation to all of you. If you represent an organization that is committed to promoting nonpartisan voter participation across your employees, members, and affiliates, we invite you to take the organizational commitment, which just states, as the leading health organization, we commit to strengthening our democracy by encouraging nonpartisan voter participation across our memberships, employees, and affiliates. We don't mind what brand you're using to do that, but if you're planning to send, voter registration reminders, if you're planning to remind your employees about deadlines, we welcome you into this work, and also have tons of resources and materials to help you think through those plans if you hadn't yet considered doing so. But then also, we want to create space for individual health professionals to join us in this initiative. So we are sharing a pledge to vote, because we know that when we commit to doing something through signing a pledge, we're way more likely to do that thing. And political science actually shows that when we sign pledges to vote, we're way more likely to actually turn out and vote. And voting is really complicated. You need to make sure that you meet those deadlines, have all of your paperwork turned in on time. And this will also allow us to remind you about those important deadlines as they come close. So we invite any individual folks to scan this QR code and take the pledge today, that you will vote, and understand that the health of my community hinges on the health of our democracy, that robust civic participation is required to advance health and racial equity. I understand that the first step starts with me, and I join my colleagues and institutions across the health sector to vote in upcoming elections, encourage friends, families, and/or colleagues to vote in upcoming elections, work with my professional organizations and/or workplace to promote Thrive Through Civic Health, we will vote, and/or support elections through volunteer roles in my local community, like the ones that Elva was talking about at the beginning of this presentation. So that concludes our, planned part of the presentation. I want to open up the floor for some questions, and I'll stop sharing so you can see more of our faces.
Thank you all very much for excellent presentation. Some people sent me questions prior to the actual webinar, so I'm going to go ahead and go through some of those, and I'll remind the people that are participating on the webinar, if you have a question, please put it in the chat box or the Q&A. But I'm curious, how is Healthy Democracy, Healthy People funded?
I can answer that just briefly. We've been funded from various philanthropy grants, and it's been a fairly small amount of funding for some infrastructure. Just for us, we had a small grant to do the $30,000 grant to help offset the cost of doing the Health and Democracy Index. I would say much of the work has been unfunded individual muscle power by people who are committed from these professional and the health arena, who have volunteered time as researchers, as analysts, as advisors. So that's been primarily, I think.
You know, you did a good job of outlining how healthy democracy, healthy people, dealing with health inequities. Thus far in your journey, what are some of the top states that have really seemed to participate and get a benefit?
I think that the ones that are listed, well, in this initiative, this is this Healthy Democracy, Healthy People is a national initiative. We are excited that we have some support from the Houston Endowment to do some work in Texas, in Houston, and to help support the development of a coalition. So Texas has some, and you're all here, so I'd count you already. And we've had other conversations with professional groups in Texas. Other groups you can see on that, on the We Will Vote initiative, some of the groups that have signed on from Kansas and Utah and Iowa, Minnesota, Wisconsin, Ohio, Michigan, California, New Jersey. I'm going off the top of my mind, remembering some of those. But much of our work is so it's both. It's, you know, you can't change these things from just one level. You have to. The work that we did at the national level is, I guess, 2 states I'm aware of have already incorporated health assessments, voting into their health assessments. That's Wisconsin and Minnesota. But the creation of the health assessment and state health plan from the public health departments, those are on different periodic, you know, they're usually 5-year plans and they happen at different times. So I don't know if that answers it.
Right. The other thing I was thinking, you know, here at the DFW Hospital Council, about 2 years ago at a strategic planning meeting, our board actually changed and incorporated in our vision statement that we as a hospital council had a responsibility to drive health equity within North Texas. And that was a good change. But with your background in public health as well as Gnora, I am curious, when did you first figure out the correlation between voting and community health?
Well, I have been working on advancing health equity for 20 some years and looking at the policy environment that connects to creating the kinds of change that is necessary. So when I go back to that very beginning definition of what are we doing together, and I mean together, it's not a service that I do for you, it's what are we doing together to assure the conditions so that everyone can be healthy. So in the field of public health, we do a lot of analysis of what are those conditions. We know that food security and housing security and economic opportunity and educational opportunity and environmental challenges are all challenges to health and do create health disparities. What the underlying tie through all of that is who's getting to decide. Who's getting to decide about the policies? Whose values, assumptions are guiding the decision making? And so in my role at the Minnesota Department of Health as Chief Health Equity Strategist, I was able to help change who is at the table deciding. And so it became, we're talking about voting today, but how permeable we create our decision-making spaces, how we open those spaces and allow and create the opportunity for different assumptions to be raised is important. And so this work is an outgrowth of work that I have been doing for 20 some years, in recognizing that we need an inclusive, representative democracy in order to make it possible for everyone's voices to be considered in decision making.
Right. Good point. We do have a question that came in through the chat. And before I ask it, I will say, I kind of gleaned that the thrust of your presentation was healthcare workers should do everything they can in a bipartisan way to register to vote and to get out and to vote and to exercise their democratic right to vote. Now, the question I'm going to ask is a very interesting question, and I used to work in hospitals, and I can almost hear the chief legal counsel giving me an answer. But here's the question. Do health organizations have a responsibility to register or guide or encourage their patients to vote?
And I can start that, or would you like to start that, Gnora?
Yeah, I'm happy to share a little insight. So I think it's really important that we remember that nonpartisan voter promoting nonpartisan voter participation is something that is totally allowable from a national perspective. I think it's really important that you explore the state level requirements and restrictions when considering doing voter registration or other kinds of activities. And I know Elva is very well versed on those rules. And so I encourage you all to check that out. But there is some guidance from HRSA saying that FQHCs are actually should and can be registering voters in their health settings. And we've seen similar guidance about other health organizations. So I definitely think it's something that we can be doing and should be doing. But, you know, as someone who's dealt with legal folks before, I want to encourage each and every one of you to consider, you know, the legal boundaries that you have to fit into, and make sure anyone who's doing that work is well aware of the restrictions in Texas, so that you're not crossing any potential lines around what's allowable and what's not, because that can be very specific to the local community and the state as a whole. But Jeanne, what did you have something to add?
The only thing I would add is that there are efforts as well for when a patient is in the hospital or is unable, as unexpected, unplanned. There are efforts, patient care voting efforts that are focused on giving guidance around that as well. So I don't know if that quite answers the question, but there's, I think from a improving the community's health perspective, we have a responsibility. Then the second level of question is, what level of engagement can my organization be involved with? And it can be as simple as encouraging my employees and, you know, to vote, and making, you know, putting signs that say, here's a code that you can scan to get to the state registrar, you know, to the voting information in your lobbies. And or it could be more of what Elva is talking about, where volunteers are coming and helping. But when you get to that point of volunteers coming to help, you have to be sure that you're following all the state level rules, because they are different from state to state, and Texas has some of the more onerous rules.
Thank you. You know, you gave an interesting slide where you actually talked about physicians, nurses, other healthcare professionals, including dentists, historically have had lower voter turnout than the national average. We saw that. Do you know why that happened? What caused the medical professionals not to vote?
Well, we'd love, you know, we're actually both data nerds, so we would love to do more research on that. But what I can say some of what I think is happening. One is, first of all, we know that some of the rules that make like the times and the you know, people's schedules may not be conducive to voting. Now, that doesn't account for the places where there is many opportunities to vote, like in Minnesota, you have all these different ways that you can vote and times, and yet we still see these same patterns. So I think that there's another aspect, and this is my own personal view, and that is that some of us in the service professions who have spent and spend every day, all year, year after year, taking care of people and providing service and helping people navigate life situations that are somewhat, are quite a bit overwhelming, might feel like we already did our job. And we might not feel like we have like we may not see ourselves as having any influence and beyond that, and we may think we may be somewhat tapped out. So part of what we're excited about this thrive through civic health, we will vote, is suddenly recognizing that there are 22 million of us in this health sector. We do have agency, but we don't necessarily feel like we can control the conditions that our patients are living and working in. But if we begin to act collectively, can we begin to have more of an influence? Those numbers for Texas are quite sad, I thought. What was the number again, Gnora? Was it 60% of the general public didn't vote?
Yeah, in 2022.
In 2022, 60% of the general public in Texas didn't vote. And if you take that other statistic, that means that it could be as much as 80% of the healthcare workers didn't vote. No wonder we don't have agency and can't change things. Right. That's my view.
I will be glad to read you this comment. It's not a question. I think you're going to like it. As a home health.
Steve, this is Elva. I have my hand up. I don't know if anybody can see it, but I had a comment before we move past that. I thought I read on your website that when licensed providers were asked why they didn't vote, the number one reason cited was they were not registered. And that's kind of what gave me the incentive to help make it easier to register. So that's my only comment.
Thank you, Elva. That's right. And that's consistent for all people when you ask them why they didn't vote, they always say that. Yeah. Thank you.
Good, sure. Good point. Here's a comment. As a home health clinician, I have been providing my patients encouragement and resources to vote using vote.org. I do not register them, but I guide them and their family members to help guide them in the registration process, or even to help them renew driver's licenses that might have expired. So, that's a real testament to what you're talking about. And then there's a good question. Since healthcare employs a lot of people, should hospitals allow some of their buildings to become voting centers? Well, I do know this in the DFW area, and I won't get into calling names. There are some hospitals that are voting precincts, and people actually come to the hospital to vote. Now, that's not at all hospitals, but that's a really good question. And I know some hospitals are currently voting precincts within certain districts. They have to be approved, obviously, by the county or the municipality, but some are doing that. And I see you kind of shaking your head there, Gnora.
Yeah, absolutely. I think this is great. I've heard similarly of some healthcare organizations in the Houston area doing the same. I think it's really important as you consider this for your own organizations, reaching out to local clerks and talking about what's possible, what's needed, and do you meet those requirements that they're looking for? Because oftentimes healthcare organizations can be great places for folks to vote, not just for the healthcare employees, who are aplenty, but also for the folks who know and trust the healthcare organization and institution and feel comfortable visiting and knowing that their ballot will be secure when they cast their vote there. So definitely encourage this. And we're not, the right people to help guide you through that process, but your local clerks would be, I think, happy to have that conversation with you.
Right. And there's a question, is there a link to those hospitals that are voting precincts? I don't have that readily available, but in the area where you vote within your precinct, you can certainly look at voting locations. They have them located and you can see if one is a hospital. At this point, y'all have done an excellent job. You've really gotten the message out. We've had excellent input and really want to thank y'all. I still am just amazed because of the work that we're doing in health equity, the link and the connection really between public health and health outcomes related to voting and really the efforts that y'all have made to look at the correlation between voting and community health. So with that, we're going to conclude the Q&A, but I certainly want to give y'all the last word. So Elva, Gnora, or Jeanne, do y'all have any closing comments before we conclude this webinar?
I'll just say, and then you guys go after to close up, but I had not thought until I just heard on this webinar today, this meeting, about the community health needs assessment and how participating in this effort would be something good to include in that when a nonprofit hospital, such as all the THR hospitals, the Texas Health Resources, which is our largest health network, hospital network in DFW, they're nonprofit. JPS is nonprofit. I'm sure Parkland is nonprofit. And I don't know what else. I don't know about Baylor, Scott and White or HCA or those. But anyway, anybody that has to do a community health needs assessment every 2 years, this would be a great thing to include in that report. So that was my only comment. You guys go now.
Oh, thank you, Elva. I just want to thank the council and all of you for convening this meeting and to raise this issue and give us a chance to help spread the word that civic and voter participation are critical for advancing health and health equity and creating healthy, inclusive communities, resilient communities. And so I'm just appreciative of this opportunity. And Gnora?
Yeah, I was going to echo Jeanne's sentiments. Just thank you both, Elva, for introducing us to the council and making this presentation even possible. Thank you to the council for hosting us and providing space for us to have this conversation with all of you. And thank you to everyone for joining and listening in. I'll put my email really quickly in the chat. So if folks want to have a follow-up conversation about how you can be a champion of inclusive civic and voter participation, please feel free to email me, and I'm happy to start that conversation. And we're just really looking forward to the potential here in Texas and Dallas and Houston, because there's so much we can do together.
One more thing. One thing Gnora said was that we currently have 63 some organizations and 99,400 some people are represented. If even a small portion of you sign those organizational commitments today, we would be able to say we had over 100,000 people. And so that's a big opportunity. You can put us over the line.
Right.
Thanks.
And I'm sure Chris has already cleared this with you, but I want to make sure I'm correct. Generally, what he does the day after a webinar, he puts out a copy of the presentations that were made, the slides, the PowerPoints. I'm assuming you're okay if he sends that to the people that registered.
Absolutely.
Great. Well, on behalf of all of the people on this webinar and on behalf of the Hospital Council, we want to thank all three of you for an excellent presentation, a great Q&A, good participation by the people that were in this webinar. And we thank you, and we hope everyone has a good day. And for the people in the DFW area, please stay cool.
Yes.
Thank you.
Okay.
Okay, thank you.